Hello, this is Dr. Stanley Lang. Welcome to this broadcast. And the topic today is on healing stress that is causing anxiety and depression. How to heal stress that is causing anxiety and depression. So, as I mentioned, my name is Dr. Stanley Lang. I'm otherwise known as the Whole Health Doc. The reason for that is because I approach wellness and health in a whole person health approach of health of body, mind, and spirit. And so I'd like to talk to you about some of these issues, body, mind, and spirit, and the approach to healing depression and anxiety through addressing chronic stress. So I want to explain first the experience of a patient that I was seeing recently who's been dealing with severe depression that has been basically disabling him and not able to do anything that is part of his usual daily responsibilities, which obviously when you can't do what you need to do, that affects everything else. It ripples into everything. And a lot of people know what that feels like. A lot of people are just barely hanging on. They are getting by, but they're experiencing this tremendous amount of stress. They're feeling anxious all the time, and they're mildly to moderately depressed, and so they're getting by. They aren't quite as disabled as this person was, but they're teetering. They're ready to fall if a little bit more stress comes into their life. So how does this happen? What's the role of stress in causing these symptoms of anxiety and depression? Well, one way to kind of look at this is that anxiety and depression are symptoms. They're diagnoses that the medical community uses, but they're actually symptoms of stuff going on under the surface. And they're crying out. These symptoms are us crying out for attention to dealing with some issues. Now, some of these issues are purely physical, but most of them are blended. There are emotional, spiritual, and physical reasons for the feeling so stressed out and the subsequent symptom of anxiety and depression. Now, antidepressants get used a lot in this situation because they do decrease the sensation of stress, but they don't treat depression very well, and they create a situation where people kind of get hooked on these things for years and years, and in some cases forever. And they still don't control the symptoms very well. But what happens is once the newer antidepressants get started, even though they're not helping that much, when you try to stop them, you feel even worse. So people end up staying on these medicines for a long time. So I much prefer using natural means to help people overcome chronic stress, overcome the acute stress episodes on top of chronic stress, and the whole constellation of symptoms that leads to. So one of the things that changes in stress, chronic stress, is the thyroid balance. Now, we have a bit of a chicken and egg issue because we can measure thyroid hormone levels that are going on with people that are really stressed out, and they may be really off, but we're not sure if the stress is causing the thyroid imbalance or is the thyroid imbalance causing the stress. And it's actually a little of both, because I've measured these phenomena in a lot of patients. But by the time somebody's been in chronic stress for a long time, the imbalance of their adrenal gland is advanced, and their thyroid becomes advanced in dysfunction because of a hormone that is called reverse T3. So I've talked about this in other videos, so I'm not going to go into a lot of detail, but reverse T3 is kind of like the mirror image of T3, and T3 is the biologically active hormone that the thyroid gland is generating to make the cells work. So the cells have these receptors for T3. And what reverse T3 does is it competes for those receptor sites. And what happens when a person is in the situation of chronic stress, it causes reverse T3 to go up. So you have essentially more competition at those receptor sites. So even if the thyroid hormone level T3 is normal, if reverse T3 is too high, the person will feel hypothyroid and they'll feel a lot more stressed. So one of the approaches that we use is when we measure that reverse T3 levels are elevated, is to give a little bit more of the hormone T3. Now, this is completely opposite to how most people treat hypothyroidism, because they give T4, which is otherwise known as levothyroxine. And if you give T4 in the circumstance I just described, it'll make it worse, because T4 given alone in the situation where reverse T3 is elevated will cause it to go up even more, and the person won't feel less stressed. So recently, the person I was talking about, we made some adjustments. I just want to show you some of the thyroid changes that happen. So in the bottom is where this person started. Reverse T3 was 19. The total T3 was 78. We also measure what is called the free T3 level, so T3 being the biologically active hormone. And you notice that the ratio is 4.1. Now, after about 4 months of treatment, which involved several different things that I'm going to talk about in a moment, you can see that the ratios changed dramatically. His reverse T3 has dropped from 19 to 10, and the total T3 went up to 115. Now, 78 is actually below normal on the measurement scale for the lab, and 115 is right in the middle of normal. But notice that the ratio went from 4.1 up to 11, just a little bit over 11. And that is a dramatic switch. And above 10 on this ratio is associated with good health. And indeed, it correlated very well with this person's symptoms. The stress symptoms had improved dramatically. But that's not the whole story, because this ratio had been achieved 2 months earlier, that improvement, and this person felt a lot better. But then something happened that was additional stress, and he tipped over into more symptoms in spite of having so-called fixed this ratio. So he definitely felt a lot better after fixing the ratio imbalance, but then additional stress produced more symptoms. So that meant we needed to use some other strategies that involved touching on the whole person, health of body, mind, and spirit. So we needed to invest some strategies for emotional health, which were started, some additional elements for spiritual health, which have to do with issues of forgiveness, resentment, and those sorts of disciplines. On the emotional health side, the issues related to all of the things that cause our self-image to be not well. And then on the physical side, looking more at all the things we could start to do to help physically. And that included additional nutrients that decrease stress, additional other lifestyle strategies that decrease stress. And so these hormone levels were, after all of those other fixes were made, and the good ratio was even better, and he felt well. So the point in all this is that we were able to measure how far off his thyroid had gotten through all of the stress that he was having. Now, was this thyroid imbalance, this ratio that is 4.1, was that causing him to feel stressed, or was it off because he'd been so stressed? Chicken and egg, not quite sure, but there's no question that adding in the additional T3 helped him to feel better. But he needed other things to really make him get better. And in this final visit, he was a lot better. And the same thing, I think, is true for most of us. We need a holistic approach to the management of stress, to healing stress, if we want to increase our odds as high as possible to getting over, especially anxiety and depression. Now, that's my take-home recommendations for you, to address physical, emotional, and spiritual elements that are causing stress to try to minimize stress. Now, we also want to invite you to have free access to our online academy. That is a stress reduction academy. Now, it's officially called Heal the Stress, Reduce Weight, because that's the main thing that people are aiming at. But you could call this Heal the Stress, Reduce Anxiety, Heal the Stress, Reduce Depression, Heal the Stress, Reduce heart disease risk, Heal the Stress, Reduce cancer risk. And all of those things would be equally true. And the strategies that we use in the program are the same. So if you're dealing with stress and you want to do something about it, that's truly a long-term solution and not just another pill to try to suppress what's going on, then I encourage you to get the program, test it out for free for 7 days. Go ahead and sign up for the free trial by clicking on the link either below this video or on the video, depending on where you're finding it. So I wish you well, God bless, and have a great day.